Broadcast is now starting. All attendees are in listen-only mode.
Good morning, everyone. Welcome to today's webinar, and thank you for joining us. My name is David Cronenberger, and I am an MPH student at the University of Texas School of Public Health. Today's webinar is hosted by the Michael and Susan Dell Center for Healthy Living at the UT School of Public Health in Austin. Before we get started, I just wanted to make some housekeeping announcements. This webinar is being recorded, and it will be archived along with presentation slides at our website at msdcenter.org. If you have any questions during the presentation, please enter them into the questions chat box, and we will have time for Q&A at the end of the presentation. I will now hand it over to Dr. Bijal Bala, Dr. Shreela Sharma, Dr. Andy Chan, and Tim Spector to start the presentation on a citizen science approach to surveillance of COVID-19 symptoms in Texas, a call to action. Thank you, everyone.
Thank you, David. So I'm Dr. Bijal Bala. I am Associate Professor of Epidemiology at the UTHealth School of Public Health and Regional Dean of the Dallas campus. Thank you all for joining us. Today, Dr. Sharma and I would like to tell you all about a citizen science approach that can help curb the spread of COVID-19 in Texas by individuals reporting their symptoms, even if it's just that they're feeling well, and doing that every day. This is a citizen science approach because all of us, Texas citizens, participation is needed. We will tell you why this approach is needed and how the use of a COVID Symptom Tracker app can help slow the spread of COVID. We also have Dr. Chan from Harvard and Dr. Spector from King's College London, who will tell us more about how the Symptom Tracker is being used in the US and in the UK. Together, we are part of the Koch Consortium, which stands for the Coronavirus Pandemic Epidemiology Consortium. Next slide, please. So why do we need to track COVID symptoms? As you all know, the COVID-19 pandemic has fundamentally changed our way of life. It's a novel virus, meaning that none of us have been exposed to it and we don't have immunity to it. Its infectious potential is very high, and it appears to be transmitting and spreading even when individuals who have it do not have symptoms. Therefore, it's silent, it's stealthy, and can infect millions. Next slide, please. So what is COVID-19? COVID-19, as I said, is caused by a new coronavirus. It is a beta coronavirus like MERS and SARS pre-pandemic in bats and have had an animal-to-person spread. The person-to-person, they spread from person to person between people who are in close contact with one another within about 6 feet, which is why we have these guidelines about social distancing and keeping distance of about 6 feet from individuals. It spreads through respiratory droplets produced when an infected person coughs, sneezes, or talks. These droplets then can land in the mouths or noses of people who are nearby, or possibly can be inhaled through the lungs. And some recent studies suggest that COVID may be spread by people who are also not showing any symptoms. Next slide, please. So based on what we know so far, the most common symptoms people experience if they have COVID are fever, cough, shortness of breath or difficulty breathing, chills, repeated shaking with chills, muscle pain, headache, sore throat, and a new loss of taste or smell. Next slide. So this is a pandemic, now having spread to 185 countries across the world, with more than 2.6 million cases and over 133,000 deaths. The US, unfortunately, is the epicenter of the pandemic right now, with over 844,000 cases and over 47,000 deaths. And COVID now is the leading cause of death in the US, even more than heart disease and cancer. And we also know that these numbers are an underestimate of the true prevalence of COVID, as the rate of testing is still very low. So we may not be detecting all the cases of COVID that are actually prevalent out in the communities. Next slide. So you can see here that as of April 20th, the US cases were doubling much faster than other countries. Although we have some good news lately with the overall slowing of the doubling rate, with all the social distancing and stay-at-home measures that we have implemented so far. Next slide. As you can see here, we're just beginning to see slower growth rate in the US, while the picture in Italy, Spain, and Germany now shows several days of slower spread. So what do we do now in the next few weeks will be really critical to continue slowing the spread and to not lead to a resurgence because of too quickly opening up our societies. Next slide. So bringing it home a little bit. So in Texas, as of yesterday, there were 21,000 cases and 543 deaths. Overall, we have done relatively better in keeping our numbers down and our healthcare capacity up. By the way, this link here below that you see can take you to a Department of State Health Services website that gives you a lot of really great information at a county level even about the number of cases and deaths that you may want to check out. Next slide. So this figure shows the number of new cases in Texas in the dark blue line towards the top of the graph. And this is plotted over the number of days. In recent days, we're starting to see a flattening of that line, as you can see, but just about starting to. Cases in Texas currently are now doubling every 18 days. So there is some hope here that the spread is slowing down a little bit. Next slide. So now that we are beginning to flatten the curve a bit, what do we need before we can start slowly de-implementing our current mitigation strategies? First and foremost, we need widespread availability of accurate testing for COVID. We also need a strong infrastructure and supply of test reagents and to strengthen the entire process of swabbing, testing, and reporting the results of those tests. We also need extensive contact tracing. We will need all of these until cases slow down more. There are effective antivirals and an effective vaccine is available. And here's where the tracking of COVID symptoms can help us a lot. So to summarize the need for symptom tracking, what I wanted to emphasize was that so far we've only been playing catch up. We now need to get ahead of it so that we can detect early, prevent the spread, monitor cases over time, and importantly, make data-driven decisions for policy and planning. Next slide. So why symptom tracking? I'm sorry, next slide. There's a lot of variation in how COVID manifests. As I showed you, different types of symptoms that that a person can experience, and with some individuals harboring infections without any symptoms. Also, there is not enough data currently that tells us a lot about the demographic, clinical, lifestyle, and molecular risk factors for COVID-19 infections. And importantly, in the context of limited testing and contact tracing infrastructure, tracking the symptoms of COVID can help us identify hotspots of COVID symptoms and also can help us target testing, importantly, to high-risk individuals and communities. Next slide. Therefore, there's an urgent need to capture in real time the spectrum of symptom onset, diagnosis, treatment, and outcomes, because the virus is new, the pandemic is spreading really fast, because there is a short interval between exposure symptoms and outcomes, and because there is a lack of widespread or systematic testing. To address these issues, next slide, please. Doctors and scientists at the Massachusetts General Hospital, the Harvard School of Public Health, King's College London, and Stanford, together with Zoe, which is a health science company, developed a COVID symptom tracker app. And we at the UTHealth School of Public Health partnered with them to set up a surveillance of COVID symptom tracking in Texas. As part of this partnership and part of being part of the Koch Consortium, the UTHealth School of Public Health investigators will receive de-identified data from Harvard for the state of Texas for analyses and for identifying these hotspots and for public planning decisions. At this point, I'll hand it over to Dr. Sharma to tell us more about the tracker itself.
Thank you, Dr. Bala, for sort of setting the stage on why we need this effort to happen in the state of Texas. Next slide, please. So a little bit, let's talk a little bit about the app. The app can be found very easily on your iPhone, or you can get it on Google Play. So I have an iPhone. I just went to the App Store and downloaded. I just put in COVID-19 symptom tracker. You can see the logo right here, and just downloaded it. And it takes about initially about 3 minutes to complete the whole form. It's HIPAA compliant, the whole entire process. Also at UT, we have obtained IRB approval, and our partners also have approvals from their institutional review boards to obtain the data and do the analysis for this effort. Next slide. So as Dr. Bala mentioned, we really need to get ahead of the epidemic. And for those of you who are Texans, just given we have a decentralized system in the way of tracing and testing and monitoring of our COVID patient population. So what we are hoping to do with this particular effort is set up this umbrella of a statewide surveillance through which we can identify high-risk areas, we can identify those who are most at risk by better understanding their symptoms and linking them to underlying health conditions, and all of which is tracked in the symptom tracker. And through this, because we can aggregate the data at the zip code level, at the county level, at the city level, we can look at how fast through the symptoms, how fast the virus might be spreading across Texas as well. So it really helps us sort of provide this umbrella of a long-term, not just short-term, but a long-term surveillance of symptoms related to COVID-19 in Texas, which is really critical to de-implement our social distancing strategies. And so as people start to mingle with each other, this particular type of tracking becomes important because it helps us get ahead of the epidemic and allows us to track, identify potential cases and provide rapid testing and other services to those areas as well. Next slide, please. So let's look at the questionnaire itself. It asks questions about you and your personal characteristics, including questions about your height and your weight and your general health status, if you've been diagnosed with other comorbidities such as heart disease, diabetes, and which might, all of which could potentially put you in a higher risk category if you do get diagnosed with COVID-19. And in addition to that, it specifically then jumps into asking you about your COVID-19 status, whether you have been diagnosed or not, and then about how do you physically feel right now. And that's when you start getting into, so if you click on I feel physically normal, that kind of wraps up your symptom tracking. But if you say you do not feel physically normal, then there's a decision tree which takes you through the COVID-19 symptoms, which we'll look into next. Next slide, please. And Dr. Chan will share their lovely decision tree in just a few minutes, but these are sort of some of the symptoms that are tracked as part of the app. So it asks about a history of whether you have fever, fatigue, headache, shortness of breath, diarrhea, loss of smell or taste, sore throat, and other COVID-19 symptoms that you might be experiencing right now. Next slide. And as you have clicked on, you've identified and documented those symptoms, it asks further, goes into where you are. So are you receiving care at the hospital, or are you still at home and you haven't been to the hospital? Have you been tested, so on and so forth? And then are you receiving treatment in regards to your symptoms? So it sort of goes through quite a comprehensive assessment in regards to your symptom tracking, but also the potential treatment and response that you have received to the symptoms as well. Next slide. Now, what is critical is that we want you to allow notifications in regards to this particular app. I know you don't, we all get 50 notifications on our phone, but this particular notification will prompt you to track your symptoms every day. And we need that denominator, even if you are well. And you'll see us emphasizing that multiple times through this presentation. This is not an app just for you to track your symptoms when you're unwell. We're looking not just at one point in time, but we want to track how the symptom activity changes and the pattern of that symptom activity over a period of time. And so as we mentioned earlier, we want to set up this umbrella surveillance system so we can track how the activity is changing over time, especially as the social mitigation strategies are lifted and removed. And so, you'll these are some screenshots of telling you a little bit of data on, how many people are contributing to the app. And as of today, there are about close to 2.6 million people contributing. And then on the 20th, when I took the screenshot, about 46,459 people in the county where I reside, Harris County, were estimated to report COVID symptoms, which is out of about 4.6 million residents. And today it was about, I believe, close to 53,000 residents estimated to report COVID symptoms. So it gives you a little bit of feedback in regards to how the COVID symptoms are looking in your area as well. One other piece in regards to the app feature that I particularly like is that you can track for other family members. So this is especially relevant if you have someone who is in a higher risk category, such as elderly family members who may not be able to download and track for themselves, that you can set up a profile and help track for other family members as well. And this is, again, particularly relevant, so we can identify how the symptoms are tracking in those higher risk and vulnerable communities as well. Next slide. So to kind of summarize again, what we are hoping to do specifically in Texas is we want to establish a surveillance system of COVID-19 symptom tracking for the entire state of Texas. And this is primarily because, it stemmed from the shortage or also the deficiency in widespread testing for our state. And we want to get ahead of the curve, even as more testing is available and perhaps the eligibility criteria for testing is broadened and we have more, streamlined reporting of the cases, we need to get ahead of the epidemic. And having a surveillance system to track the symptoms is the best way to get ahead of the epidemic because it allows us to identify those hotspots in the state and allows us to estimate the potential incidence and spread of COVID-19 in Texas and get ahead of it. But most importantly, we want to use this information to support and inform the public health decision-making for COVID-19 in Texas. We will not only see how people who were well, if they are becoming symptomatic and how the spread is occurring in the state, but we will also be again able to identify those high-risk areas and the hotspots as well. We hope to have a dashboard up soon, so all of the data that we are analyzing can be displayed and updated in real time. So folks in all spaces and all sectors can avail of the information easily and rapidly to help inform what they are doing as well. Next slide. So this is just a little bit of a snapshot to demonstrate what we're seeing thus far. As I mentioned, we will have a dashboard up hopefully in a few days that will allow us to display the data in real time as we get more data dumps from Harvard so that we can look at how the spread looks like from day to day and week to week in the state. But this is just a little bit of a snapshot of what we have today. So there's a sampling strategy on the back end in regards to this app, such that if you once you reach critical mass at the county level, that data then can be extrapolated to the other residents in the county. And so thus far we've had over 6,700 Texans who are tracking their symptoms actively. This was as of yesterday, of which 15% are reporting symptoms of COVID-19. And there's a little bit of information here on what the spread of those symptoms look like. So 11% report that they have fever, 27% reporting persistent cough, 50% reporting fatigue, and there's various levels of fatigue that you can choose from, going from mild to severe. And similarly, with shortness of breath, 75% are reporting shortness of breath, of which 72% say it's mild, and 3% are reporting severe shortness of breath, loss of smell and taste, 25% chest pain, and 21% diarrhea. And these are symptoms that they're experiencing right now. And it's as you can see, it's critical for us to have this information because many of them may not have gotten tested for COVID either. But as we can map out the data and understand where the spread of the symptoms is occurring, we can potentially get the services to them as well. Next slide, please. So with that, our work evolved from a much larger effort that's happening in the UK and the US that Dr. Chan will and Dr. Spector will talk about over the next few slides. But this was, very serendipitous for Dr. Bala and myself because 2 weeks ago, less than 2 weeks ago, we were just talking about this, given the variability in testing, that wouldn't it be nice to have symptom tracking and have a surveillance system for COVID-19 symptom tracking in Texas. And on that very day, an email from Dr. Chan came into our inbox that outlined that this effort is already happening and has already taken off in the UK in a significant way. And we jumped on it right away, and Dr. Chan and his team was extremely responsive and helped get us set up right away. And we were very excited to hear about the work which Dr. Shannon,
Hello, I'm not sure if I think everything is kind of,
hand it over to you.
can you guys hear me okay? Because I'm having a hard time hearing.
Yes, we can hear you, Dr.
Andy,
Chang.
yeah, this is Bijal. We can hear you. So it appears that something went wrong on Shreela's side.
Okay. No, thank you, Dr. Bala, Dr. Sharma. I really appreciate the opportunity to reach out to your listeners. I know this has been a very fast-moving project, and we're very grateful to have the support of your efforts as well as the support of the people of Texas to really make this a reality in terms of a public health intervention. I just want to, before I discuss a little bit about the U.S. effort, I do want to provide kind of my personal story behind why this is so important and why we want everybody who's listening to really take this up as a personal call to action. I think I'm an epidemiologist, but also a physician, and I think it's very clear that this is a crisis that is unprecedented in our lifetime. It is also something that we all have to rally to fight. And I think that we are all doing so in our own ways. I know as a physician, my colleagues who are in various aspects of medicine have taken up the call to action in different ways. So those of us who are specialists in given areas are now responding to the COVID crisis by really becoming COVID doctors, even if that's not what we were doing before. And I think for those of us who are epidemiologists or public health specialists, even if we're not folks that are necessarily doing work in infection control or in infectious diseases, know the importance of using epidemiology and data from large populations to really inform science and our public health response. So with that, we have pivoted to really develop this as a way for us to respond as a public health community. So many of us in the audience, I know, are public health professionals, have access to large communities of followers, people who look to us for leadership in response to a crisis. So we hope that these are the kinds of people that are listening today and are willing to take this up to their respective communities. But also, if you're listening as just a member of the community, we want to point out that this is an important initiative for you to be able to contribute data over just the course of a couple of minutes a day that can really be invaluable to really providing the data that scientists need to respond to this crisis and to fill in the gaps that are out there. We obviously wish we knew more about COVID-19. We wish we had more testing. We wish we had a better capacity for our healthcare system to handle this. But we are where we're at, and I think we can do what we can as citizen scientists to contribute to the response. So with that, I will talk about what we've been doing in the US. So next slide. As Dr. Bala and Dr. Sharma have pointed out, we are doing this across the country in a national response. One piece of this that I want to really highlight is the importance of also using this as a method for us to collect data for us to respond in real time to the current crisis, but also to set us up to respond in the future for potential long-term ramifications of COVID-19 and also for potential other infectious diseases that may become a problem in the future. Specifically, we have set up what we call the Koch Consortium, the Coronavirus Pandemic Epidemiology Consortium, where we've actually not only reached out to members of the public, but public health professionals like Dr. Bala and Dr. Sharma, but also leaders of large population-based studies across the United States. There are many studies in the United States that are currently ongoing, which involve volunteers that offer to provide information about their diet, their lifestyle, their medical illnesses, and that is the group of people that we really want to reach out to because we want to know, number one, are they okay during this pandemic? And number two, what are their experiences as being just members of our public? And can they share those experiences with us in terms of symptoms and their exposure and access to testing and their clinical outcomes, so that we can then take that information and connect it back to their data that they've already offered us through their other studies. And this has been an enormously successful approach in allowing us more insight into the risk factors for COVID-19, but also potentially the long-term outcomes. So this is a website that's currently available for investigators to look at, but we also have a website down there, covid.joinzoe.com, which gives you the information again about how to download the app yourself. And if you're an investigator, it does direct you also to some specific study tools that we can offer you to help network this initiative, but also to invite participants in your study to be part of this collaborative. Next slide. So as mentioned before, this again is an app that allows us to, again, just take a minute a day, whether you're feeling well or not, to report how you're feeling and gives us estimates within your community. Next slide. And as a real-time epidemiology tool, I would highlight that we have the ability for us to understand whether the people that are responding to the app are a member of a research study, in which case they're providing some additional consent, which allows us to connect data back to their original studies, which gives us more information again about some of the risk factors for COVID-19 and allows a longer-term relationship with participants so that we can track in the future potentially how you might be doing if you do happen to get COVID, or even if you don't get COVID, how you're doing long-term with respect to some of the measures that have been in place. We know that as a healthcare system, this has put an enormous strain on all of us. So we know, for example, patients that are living with cancer or have heart disease or other ailments are actually not able to see their doctors and are not getting the kind of preventative care that we would ideally like them to get. They're also deferring treatment in some cases. For example, there are patients that have cancer that are not getting surgery or not getting chemotherapy. So we need to know long-term what are the implications of those things that are happening in response to COVID-19. In addition, we know that the response to COVID-19, like social distancing or the financial ramifications of not being able to work or losing your job, will have additional long-term implications in terms of financial stress, mental stress, and also physical ailments. So we would like to be able to, and we can best do that now if we collect the information now on how people are affected. Next slide. So here's where we're at across the country. Dr. Bala and Dr. Sharma did share with you a Texas-specific snapshot of the data. But I do want to emphasize this is data that we're collecting across the country, which is going to be helpful since as a country, we're at all different phases of the pandemic. So we are a very large, diverse country in terms of the number of people that live in different areas. Also the types of work that people do, the different living situations that people are in. So it will be important to have a very national approach to this and have have each state be able to contribute sufficient data. On the left-hand side, you can look at the United States and see where we have our users. You can see that all of you should be quite proud that Texas is in dark blue, meaning you have a large number of participants. In addition, our other major states are California, Florida, New York, Massachusetts, again, all high population areas, which are also seeing a large number of cases. It's interesting to see also on the right that the states that have the most users are also not necessarily the states that are having the most with respect to symptoms. And so there is the ability, again, to use the fact that we have a lot of sort of citizen scientists out there in different states reporting data. It gives us, again, a ability to compare across the country how people are experiencing symptoms and whether those symptoms ultimately might predict where there are potential hotspots for disease, and also where there are potential areas that the disease is getting better. And if the disease is getting better, this may guide us in a more rational way as to whether we can start to loosen interventions like social distancing or home isolation. So this data is important to have across the country at all phases of the pandemic, because it does provide us so much information that we otherwise would not have based on just using the records that are coming in from the hospitals or from other reports where we don't have a sense of what's happening across our communities. Next slide. So I do want to highlight this has been a partnership with our collaborators and scientists at in the UK, including Dr. Spector, who I'll introduce now. The UK has been a remarkable example of how the citizen science approach has worked and how it can in real time serve a public health purpose and actually make a difference. So we are really lucky to be able to partner with them and have their support and also their resources to help make this a reality in the US. In addition, I guess they provide a proof of concept that we can do this as a country, and we can do this in our own individual communities to really make a difference. And again, I just want to leave everybody with this message. Take a moment to download the app, take a moment to reach out to your network, and if each of us connect with 5, 10 people, we'll grow the initiative and have a lot more data within your state and across the country to really make a difference in this fight. So with that, I'll turn it over to Dr. Spector, who can talk about this data that was collected in the UK and also more broadly about the impact that this has been having across the pond.
Thank you, Andy. And just to introduce myself, I'm a genetic epidemiologist and also a physician occasionally. We started in the UK with this idea by just over a week earlier than in the US, and it took us by surprise because it went viral in that we had over 1 million downloads of the app within about 36 hours. So it was one of the best selling free apps ever, I think, and it has become probably the world's largest community health or citizen science project. So that's quite an amazing thing to get going in such a short time. And it really captured the imagination, I think, of the British people, which in comparison is a very small little island that fit nicely into Texas somewhere. But we do have 60 million people squashed into this island. And the first thing that we were able to look at with this app was to see how many people were being affected pretty much, and we just about caught the peak of the epidemic. So we started recording in about the 24th or 25th of March, just as the country was put into semi-lockdown. People were told to stay at home, and they closed everything. And rates went up for about 3 or 4 days. As people were together, they obviously had been infected by other people, and they just infected the people around them. And then from that time, we've seen the effects of isolation and social distancing work, and rates have come down from an estimated 2 million people down to the latest figure, which is about 450,000. So it's halving about every week at the moment. And we see that our graph going down to about levels below about 100,000 people for the whole country, with most of these are, of course, with very mild symptoms. So the difference between these statistics and the ones that the government provides are that this is what's happening in the population, and this is not captured by the hospital statistics. And on average, the symptoms we see generally occurring 12 days before hospital admissions, and probably about 4 weeks before you see the deaths. And so this is really important because we are seeing a whole range of symptoms that aren't being picked up by the official agencies that do some of this testing, because they will only test people who have classical symptoms, certainly in the UK, such as fever or persistent cough. whereas we've found lots of new symptoms like lack of taste and shortness of breath, chest tightness, severe fatigue, muscle pains, etc., as being very predictive of a positive result. I should just say that out of our group, we now have over 30,000 people that have had a PCR test. And so we use that as a training set to put all our symptoms into an algorithm and work out the predicted score of predicted COVID positivity. And that's what we're presenting here in these percentages. So there's a whole wealth of stuff on symptoms we could discuss, but the main point, I think, of this discussion is how can you use this data to enable us to get out of lockdown quicker. That's what everyone wants. And how do you do that? Well, I think it's like a radar device. If you look at these maps, you can see how the hotspots changed, and we were very surprised because initially we saw obvious places: London, Manchester, Glasgow were the main areas where high levels of disease were happening. But also we found some strange places, like in that bit in Wales. If you point go left a bit, you can see there's a red hot area where the circle is on the left, and that hotspot on the south part of Wales we picked that up a few days before hospital admissions started getting out of control in that area, and likewise we picked up other hotspots later on, particularly around Liverpool, which was related to a football match. And so we were able really quite well to pick up some of these high levels, and we're hoping that now we've got I think at least around 1 million people tracking every day in the UK. We're starting to get the level of granularity that we can, once levels have got down close to zero, we should be able to see new hotspots, and within 24 hours, get them to a testing center, isolate them, and follow up on their contacts. And that method is going to be about a week faster than waiting for people to self-report to some phone line or through random testing. And this way we're much more agnostic as to what the symptoms are, because we have found about 12 different symptoms that are all related to positivity, and with our algorithm we can predict at the moment this combination of symptoms is about 60–70% predictive of having a positive swab test. So we're very excited with this. We give our data every day to the government, and we're just going to start a validation test using government test centers to get a subsample who are presenting with symptoms tested rapidly within 24 hours to see if we can validate all these algorithms, so that rather than testing, we can use this unique tool of symptom collection as a surrogate and allow us to get out of lockdown quicker. And that's really, it's very exciting. And just reinforce what Andy said, we think physicians, particularly epidemiologists, can spread the word, and also the idea you can log on for elderly relatives and people with diseases. And we've just had the approval of all our Royal Colleges, all our of medicine, physicians, surgeons, obs and gynae, pediatrics, and all our major charities endorse this app in order that that can get spread widely into this at-risk community as well, who haven't yet been using the app as much as as healthy people. So with that, I'll leave it and hand back over to you, and we'll take any questions.
Thank you, Dr. Spector. Next slide, please. So we're coming to the end, and just to bring it back home, I really like how Dr. Spector framed it for us, because we don't have infinite resources, right? We need to be smart with our resources and deploy them, and the symptom tracker can really help us do that in identifying those hotspots and high-risk areas and populations. So how do we disseminate the app? Dr. Bala and I and our colleagues at the School of Public Health across the 6 campuses in the state are working hard to spread the word and spread the information regarding the app. We have a language and letters of invitation that we are happy to share. Our email is at the end of the webinar. If anybody wants to reach out to us, we are happy to share the information as needed. We've shared it with our local, county, state health departments and has been disseminated through those partnerships. We have shared it through social media. We have shared it with our other partners, including community service providers, healthcare providers, and we will continue to do that as well. But the power really is with every citizen. And this is a citizen science approach. We need citizens to engage. We need the data to be driven by the numbers. And so we really want the citizens of Texas to share it with your friends and your family and your employers, because we need this data-driven decision-making to happen in the state of Texas. Next slide. So just to summarize, what you can do is you can, of course, download the app every day for yourself and track, even if you are well, and you can do it for your family members as well, especially the ones who might fall into those high-risk categories and are unable to track for themselves. You can share the app with your coworkers, your friends and family, help them download and track the app. Don't forget to set it to receive notifications every day. You can share the app with your employers, other organizations. Again, we have language and invitation letters that you can share, and we are happy to provide those. Once we have our dashboard up, we will be posting that information on there as well. And we particularly need help to disseminate the app to high-risk group. Some of them include healthcare workers, elderly, our first responders, social service providers, grocery store workers, people who are on the front lines and have a lot of interaction, need help in disseminating the information to those groups as well. So next slide, please. So we want to thank everybody for joining us today. Our information, the webinar will be available for everybody to download and share. Our contact information is here. You can also download now while you're waiting for the questions. But we really need citizen participation for a citizen science approach to work. So this webinar really is a call of action for all of us Texans to take this into our own hands and support the effort for symptom tracking. Thank you. I'll hand it back over to you, David, to moderate the questions.
All right. So thank you to Dr. Bijal Bala, Dr. Shreela Sharma, Dr. Andy Chan, and Dr. Tim Spector. So we're going to go ahead and get started with the questions. A lot of them have already been coming in, but just a reminder, please be sure to type your questions into the chat box if you'd like us to take a look at them. So one of the first questions that came in is actually a pretty simple one, is how do we do a daily report if we don't have a smartphone? Is there any kind of like website or any other way to report, or do we just need to use a smartphone?
I can answer that. I think that we recognize that not everybody has a smartphone. Fortunately, a large proportion of the population do have a smartphone. It is based on a smartphone or iPad or some sort of tablet-like device. So if you have access to at least an iPad or a tablet, it can also work on that platform. Having something available through the web is something that we would love to be able to do. This is very much a, not only is it a citizen science effort, but it's also an effort on the part of our partners who have really donated their time and effort to create this app for the iPhones and iPads. So it is something we'd like to do in the future, but we're stretched rather thin at this point, but eventually we'd hope that we can provide something that allows data entry through the computer.
All right, thank you. So another question that came up is what can be some ways that can be implemented to increase the use of this app among states with not much representation?
This is Bijal, I can answer that. And Dr. Sharma, I think her internet is a little laggy, so she's having difficulty taking questions. So there are a lot of different ways that the app can be disseminated and the word can be taken out. So for example, in my county, I am working with our school districts and the PTAs of the school district to help get the word out to parents who are part of the PTA. I also worked with a religious organization that I'm a part of to get the word out and did a similar webinar for them to take questions. So those are at least a couple ways you can think of. If you are able to connect with your local government in a smaller county with fewer people, that would be another way to get the word out. So just a few examples, and Andy may have a few more to think about.
Okay. Another question on promoting the app is, are there outreach materials available? Are they available in different languages? And is the app available in multiple languages?
Right. So the outreach materials are available. We have drafted an invitation letter that individuals can, that it can be sent to individuals. We have not yet done it in other languages. You know, I think that getting the letter and the outreach material in Spanish would be fairly easily doable, and that's a good suggestion. But the app itself, I believe, is only in English.
Yeah, there is a version in Swedish, but it's taken a while to do that. Require it's just time and money, and takes people away from the main focus. That's the problem. But so it's still possible.
I think particularly if we get a lot of people, I think in particular, if we can get a lot of people to use the app, I think we'll have much more of a rationale to really get it out in multiple languages in different countries. So I think it really does really start with all of us to prove and show that it's actually a useful tool. And I think we'll at that point have the resources to really expand it to other communities.
This is Shreela. I just want to add that you know, you can use the feature to add someone's profile who may not be English speaking, especially if they're in your family. And so I think, you know, it's important for us to maximize what we have right now and establish value for the app so that we can then expand on these other features as well. I know that's particularly relevant in Texas, just given we're cognizant of that, that given our large diverse population, that's particularly important. So that's a good question and point well taken.
Okay, so there's been a few questions asking about confidentiality and security with the app. From one is asking, will the app ask for sensitive personal information like the social security number, date of birth, etc.? Could you guys speak to any concerns about you know, confidential information and security with the app?
I can take that to begin with. I'm sure others also can jump in. So for sure, no social security number, no personally identifying information. There is, to set up the account, like any other app, you'd be using your email address to set it up. But beyond that, all the information that you input is de-identified. It's at a zip code level, there is no address information involved in it. And also that data that we receive to look at the level, the prevalence of symptoms is again also at a zip code level with no identifying information whatsoever in it. And as Dr. Sharma mentioned, even though it's a very low risk study, we also have IRB approvals through all the different institutions that are involved in this work.
All right. One interesting question that I see here, is there any benefit to downloading this app when I haven't been in public since March 17th?
This is Shreela. Yeah, go ahead. Go ahead, Andy. Go ahead.
All right, yeah, we want everybody to use the app regardless of your situation. So whether, again, you feel well or don't feel well, whether you're at home, whether you're in public, because the point of the app is to collect information from all walks of life, all exposures, and all areas of the country. So the more representation we have from people who are experiencing different types of responses to COVID-19, the better.
And I'll just add to that. Sorry, Tim, go ahead.
Okay, well, I was just going to say we're adding some questions about isolation into the app as well, so that people will be able to say what level of isolation they've been under for the last few weeks. And that will also give us a handle about sort of stratifying these new symptoms by level of isolation. So we do need people in all those strata, as Andy said.
And because we are looking at changes over time, you know, social isolation will change. And so we want to track these symptoms over time as those social distancing strategies are removed and such. So it's going to be important for us to track not just one time, but every day, for us to really start looking at those patterns over time.
Okay, so we have one question is, do the results from the app so far correspond well to the existing estimates of COVID-19 cases?
Dr. Spector, do you want to take that question? Because some of just because there has been a critical information in the UK, in the US, we're kind of just getting started.
So, I mean, nobody really knows how many cases there are, and we have this problem that even testing is not 100% sensitive, so there'll be lots of false negatives from nasal swabs. But I think we get a much better estimate using the symptom tracker than you do just by, you know, looking at phone lines or hospital admission rates. So our estimates are based on this algorithm that has I think 67% predictive value of having a positive swab test, which is reasonable. Gave us the estimates that at its peak was around 5% of the population was affected, and in those 3 days. Okay, so that's not a cumulative, that's a sort of point prevalence rather than a normal cumulative prevalence. So we're trying to work this out more precisely, but it's now fallen to around 1% of the population, but obviously it's accumulated over those 4 weeks. So it's looking like, based on just our combination of symptoms that map to that swab, it's perhaps about 15% or something like that. but it will be higher in some groups like healthcare workers, and it's going to vary between cities and urban areas because we see much more in cities than in urban areas as well. So I think we're going to do some more detailed calculations, but it's of that order of magnitude, and that's what we need to be talking about more, what's actually happening out there in the community, not just in the hospitals.
All right, well, it looks like we are running out of time. So thank you everyone for attending today's webinar. We really appreciate you being here, and we hope you'll help spread the word about this application. Remember, this webinar will be archived on our website at nsdcenter.org. Thanks again for joining us today, and we hope we'll see you next time.